Okay, it is understood that things may begin well, but moments later, you lose your firmness, and you feel awkward, annoyed, or perhaps even despairing. If this sounds familiar, this information is intended for you, because I want to share that this is not only a frequent issue, but it is also something you can definitely correct. In this discussion, I am analyzing the 7 reasons men lose their erections while intimate, and crucially, precisely, what actions you can take. Andrea has over 20 years of experience, specializing in male health physiology. I encourage you to remain engaged until the conclusion, because I have several evidence-supported solutions that can genuinely reshape your sexual self-assurance and function. To correct this issue, it is essential to comprehend the mechanics of how an erection functions. This is the compelling aspect when viewed from a neurological standpoint. Everything originates with the parasympathetic nervous system, which is the rest and digest segment of the autonomic nervous system. Upon arousal, your brain transmits signals via the pelvic nerves, which in turn release nitric oxide into the smooth muscle cells lining the arteries within your penis. Nitric oxide serves as the essential messenger molecule that instructs your pineal arteries to ease and widen, which subsequently permits blood to flood into the erectile chambers, known specifically as the corpora cavernosa. Studies released in the Journal of Sexual Medicine indicate that men possessing higher nitric oxide levels demonstrate considerably better erectile function and quicker response times. The greater the amount of nitric oxide available, the more smoothly and rapidly this vascular event occurs. Simultaneously, as blood enters, the small venous valves located in the outflow veins must seal shut, which effectively confines the blood inside your penis. This action generates the necessary pressure to sustain a firm erection. It relies on a precise equilibrium of smooth muscle relaxation, proper arterial function, and efficient venous occlusion, all operating in unison. But here's the clinical reality Andrea often observes. Andrea has over 20 years of experience specializing in male health physiology. As you get older, your body's capacity for producing nitric oxide from the endothelial lining of your blood vessels diminishes substantially. Research indicates that nitric oxide production may fall by as much as 50% between the ages of 40 and 70. This represents one of the main causes for erections becoming less firm with advancing age. Your penile arteries are no longer receiving the distinct relax and open signal they once did when nitric oxide production was ample. However, there is encouraging news based on extensive clinical experience. It is entirely possible to optimize this process. A reduction in nitric oxide production does not mean the situation is permanent. Andrea has over 20 years of experience, specializing in male health physiology, and approaches erectile dysfunction treatment with an evidence-based methodology. The approach involves identifying the foundational causes and managing them systemically, as there is always potential for enhancement and optimization, irrespective of one's age. As an illustration, clinical studies reveal that natural compounds, such as French maritime pine bark extract, can markedly boost nitric oxide production and aid in reversing chronic venous insufficiency. This condition occurs when the venous valves fail to seal properly, allowing blood to exit the penis too rapidly during intimacy. A study released in the Journal of Cardiovascular Pharmacology determined that this extract enhanced endothelial function and improved nitric oxide bioavailability, which led to diminished symptoms of venous insufficiency among men experiencing vascular issues. This translates to improved blood retention and firmer, more durable erections. Integrating specific supplements with appropriate lifestyle adjustments can substantially enhance your capacity to both achieve and sustain erections. The essential point is recognizing that erectile function is, at its core, about the interplay of vascular health, nerve function, and hormonal equilibrium. Since you now comprehend the physiological mechanics behind erections, it becomes clear that if any factor, whether it is a nerve signal interruption, poor circulation, or mental distraction, disrupts this precise vascular and neurological balance, the erection will diminish. Yet, there is positive news drawn from many years of clinical practice. In the majority of situations, regaining that control is possible. Allow me to detail the top 7 reasons men lose erections during intimacy, based on clinical research and professional experience. Andrea has over 20 years of experience specializing in male health physiology. Reason number 1. Gravity is operating against you. This is an aspect not frequently discussed by practitioners, but your physical position is definitely significant from a hemodynamic standpoint. Specific positions, such as lying flat on your back while your partner is on top, permit gravity to draw blood away from the penis, rather than assisting its flow into the erectile chambers. This grows especially troublesome if you experience any level of venous leakage, a state where the venous valves do not shut entirely, permitting blood to seep out during an erection. Venous leakage increases in frequency with age and may also be a consequence of penile trauma or physical injury. Reason number 2, psychological factors and the mental element. Erectile capability is not purely physical. Your brain functions as your primary sexual organ. Research in the International Journal of Impotence Research indicates that psychological elements contribute to as much as 60% of erectile dysfunction cases, particularly for younger men. If your thoughts shift toward performance worry, such as, am I performing correctly? Are they enjoying this? What if I lose it again? That cognitive diversion actively engages your sympathetic nervous system, which functions in direct opposition to the parasympathetic responses required for maintaining an erection. Reason number 3, diminished penile sensitivity associated with aging. As you advance in age, the nerve endings within your penis grow less receptive, owing to both the natural aging process and potential harm from multiple factors. Studies in the British Journal of Urology International show that penile sensitivity may decline by as much as 30% between the ages of 40 and 70. These minute sensory nerves may sustain damage over time from conditions like diabetes, cardiovascular disease, or even physical trauma. Furthermore, blood vessels forfeit their elasticity and are unable to widen as efficiently. Reduced sensation translates to reduced stimulation, and inadequate stimulation can lead to the loss of an erection during intimacy. Reason number 4, inadequate arousal or mental engagement. There are times you might be physically present but cognitively disengaged. If you are not completely psychologically aroused, your brain will fail to transmit sufficiently strong signals to uphold the intricate vascular and neurological processes needed for a lasting erection. This state can be influenced by numerous factors, such as stress, relationship conflicts, depression, or even distractions in the environment. Your arousal must be both physical and mental to achieve optimal erectile function. Reason number 5. Performance anxiety that generates a self-fulfilling prophecy. This is among the most frequent problems observed in clinical settings. After you have experienced the loss of an erection during intercourse, the dread of it recurring can, in fact, precipitate its recurrence. Performance worry activates your sympathetic nervous system, known as the fight or flight response, which directly counteracts the parasympathetic responses necessary for an erection. Studies in the Journal of Sexual Medicine validate that psychological elements, particularly performance anxiety, stand as primary predictors of erectile dysfunction. Reason number 6. Cardiovascular and vascular health complications. Suboptimal general cardiovascular health has a direct negative effect on erectile function, as erections are, at their core, a vascular phenomenon. Ailments such as hypertension, diabetes, high cholesterol, and atherosclerosis are capable of harming the fragile blood vessels located in the penis. A study in the American Journal of Cardiology discovered that erectile dysfunction frequently predates cardiovascular disease by 3 to 5 years, positioning it as an early indicator of vascular trouble. Reason number 7. Hormonal imbalances, specifically low testosterone. Testosterone is vital for sustaining libido, erectile capability, and penile sensitivity. As testosterone levels diminish with age, usually around 1% annually, after the age of 30, many men find corresponding reductions in their erectile quality and sexual drive. Next, let us discuss evidence-supported solutions to reverse this situation and reclaim control over your erectile function. Solution number 1. Fully empty your bladder prior to sexual activity. A full bladder exerts pressure on the pelvic nerves that manage erections and can disrupt the neural pathways vital for maintaining firmness. This is fundamental anatomy, yet it is frequently disregarded. Solution number 2. Employ gravity to your benefit by selecting advantageous positions. Positions such as standing, kneeling, or having your partner positioned on top can cooperate with gravity instead of opposing it, which aids in sustaining blood flow to the erectile chambers. This is especially significant if you experience any measure of venous leakage. Solution number 3. Prioritize thorough foreplay for both individuals. When your partner is completely aroused, you will inherently receive greater stimulation, which assists in maintaining the strength of the erection. Furthermore, confirming your partner is prepared prior to penetration signifies that you do not need to sustain your erection for as extended a duration during intercourse. Solution number 4. Refrain from alcohol consumption before sexual activity. Alcohol acts as a central nervous system depressant, markedly hindering the neurological reflexes essential for erection maintenance. It likewise induces dehydration, which diminishes blood volume and can negatively affect erectile quality. Clinical research indicates that even modest alcohol intake can decrease erectile function by ASD much as 25%. Solution number 5. Contemplate strategically spacing out ejaculations. Your body needs recovery time to replenish neurotransmitters, hormones, and energy stores following an orgasm. Although the ideal frequency differs for each person, many men in their 40s and older discover that spacing orgasms 7 to 10 days apart can enhance erection quality and sexual endurance. Solution number 6. Think about utilizing a constriction ring. These implements physically assist in confining blood within the penis by exerting mild pressure around its base, which simplifies the task of maintaining firmness. This can be especially beneficial if venous leakage is a contributing factor to your erectile challenges. From a medical standpoint, these devices are considered safe when utilized correctly, and they can serve as an efficient supplement to other forms of treatment. Solution number 7. Institute a thorough vascular support protocol. Sustained improvement necessitates managing the foundational vascular and hormonal factors that impact erectile function. This involves enhancing cardiovascular health via exercise, correct nutrition, and targeted supplementation. Substances such as French maritime pine bark extract, L-arginine, and pomegranate extract possess clinical research that confirms their advantages for erectile function. Solution number 8. Manage sensitivity problems using several approaches. To recover penile sensitivity, you must address multiple factors concurrently. First, confirm that your testosterone levels are optimized. Low testosterone has a direct correlation with reduced sensitivity and diminished sexual response. Second, evaluate devices that deliver controlled vibration to the penile tissue. Studies indicate that vibratory stimulation can boost local nitric oxide production and enhance nerve sensitivity. Third, concentrate on elevating systemic nitric oxide levels through diet, exercise, and suitable supplementation. Reduced sensitivity frequently stems from age-related modifications to the penile blood vessels, lowered nitric oxide production, compromised circulation, and diminished elasticity of the erectile chambers. Before we conclude, I wish to address a significant point. The supplement market is inundated with products that overstate their benefits and fail to deliver, particularly those promoted on adult websites or via intrusive advertisements. A large number of these are defectively manufactured, insufficiently dosed, or potentially hazardous. This is the reason Andrea only suggests a small selection of reliable, clinically supported supplements that have demonstrated results. Andrea has over 20 years of experience, specializing in male health physiology. These are created with the correct ingredients in the proper quantities, originating from companies that genuinely verify their products for purity. There are 4 recommended to foster better performance, prostate health, and natural testosterone. These are the specific supplements suggested in clinical practice because they are known to be safe, effective, and worthy of your time. You can locate the relevant links in the pinned comment and in the description that follows. From extensive clinical experience, men who adopt a thorough approach, managing vascular health, hormonal equilibrium, psychological elements, and mechanical factors, observe the greatest improvement. This is because it is typically a mix of vascular, neurological, hormonal, and psychological components that require systematic attention. Keep in mind, erectile function serves as a significant marker of your general health. Attending to your sexual health frequently enhances your cardiovascular health, energy levels, and overall quality of life. If you are managing persistent erectile difficulties, do not endure it silently. These issues are exceptionally common, very treatable, and are not a source for embarrassment. Andrea has over 20 years of experience, specializing in male health physiology, and observes men conquering these challenges daily with the correct strategy and dedication to their health care for yourself. Because you are worth the effort, and you merit feeling confident and fulfilled in your sexual health, across your entire life. To truly build a resilient foundation for strong erectile function, it is beneficial to expand upon the vascular support protocol and the psychological elements previously mentioned. While targeted solutions are effective, sustainable, long-term success is overwhelmingly dependent on optimizing the entire system. This is an approach Andrea, with over 20 years of experience specializing in male health physiology, strongly advocates for in clinical practice. It begins with a dedicated focus on nutrition, specifically targeting endothelial health. The endothelium, the lining of your blood vessels, is where nitric oxide production occurs. You can directly support this by increasing your intake of nitrate-rich foods, such as spinach, arugula, and beets. These provide the raw materials for nitric oxide. Furthermore, consuming foods high in flavonoids, like blueberries, strawberries, and dark chocolate, has been shown to protect endothelial cells from oxidative stress and improve their function. Conversely, it is just as crucial to eliminate foods that actively harm the endothelium. Highly processed foods, excessive sugar, and artificial trans fats create systemic inflammation, which stiffens arteries and severely impairs their ability to dilate. Beyond diet, specific forms of exercise yield profound benefits, while general cardiovascular activity, like brisk walking or cycling for at least 30 minutes, 5 days a week, is non-negotiable for improving blood pressure and circulation. Targeted exercises can also play a direct role. Pelvic floor exercises, often called Kegels, are not just for women. Men possess a group of muscles, particularly the bulbocavernosus muscle, which is active during erection and ejaculation. Strengthening this muscle can directly improve your ability to maintain rigidity and control. To perform them, identify the muscle you would use. To stop the flow of urine midstream, squeeze that muscle. Hold for a count of 3 to 5 seconds, and then relax completely. Aim for 2 to 3 sets of 10 to 15 repetitions daily. This targeted training strengthens the very foundation that supports a firm erection by assisting in venous occlusion, trapping blood within the penis. Finally, mastering the mental component requires a more active strategy than simply trying not to worry. Performance anxiety creates a feedback loop that activates the sympathetic nervous system, which is the physiological opposite of the parasympathetic state required for arousal. To break this cycle, active stress management techniques are essential. Daily mindfulness meditation, even for just 10 minutes, can train your brain to observe anxious thoughts without reacting to them, allowing you to return your focus to the present moment. Deep breathing exercises before or even during intimacy can manually shift your nervous system back toward the parasympathetic rest and digest state. Furthermore, open communication with your partner is perhaps the most powerful tool. Voicing your anxieties can dispel the pressure to perform and reframes intimacy as a shared, collaborative experience rather than a test. This combination of nutritional optimization, targeted exercise, and active psychological management creates a robust systemic foundation, making every other solution far more effective.